Welcome to the Transparency Room, presented by FareVet, where we bring you real stories from people reshaping the pet space. I'm your host, Emily. Today, we're speaking with someone who has become a leading voice in veterinary advocacy. Dr. Judith Samson-French is the founder of Banded Peak Veterinary Hospital and a passionate defender of both animal well-being and pet owner empowerment. Dr. Judith, thank you for joining us.
Hey, thank you for having me.
Okay, so Dr. Judith, you've been an outspoken advocate for animal well-being for years. For listeners who may be discovering your work for the first time, could you share a bit about your background and what drives your mission at Banded Peak?
Yeah, so my background is very varied. It's not the typical background. I started as a veterinarian doing large animal practice, mixed animal practice. I've done emergency work. I've worked with ostriches for 10 years. I went to Woods Hole Oceanographic Institute to learn about aquatic veterinary medicine. And through all that, in the end, I decided that I'm going to stay put in one place and founded Banded Peak Vet Hospital just in the foothills of the Rockies. And this is where I implemented a program called Dogs with No Names, where for the first time in the world, I started to use a contraceptive implants to manage population of unwanted dogs. So it's been a long pathway in veterinary medicine, but it has allowed me to understand veterinary medicine from many perspectives.
So you've spoken publicly about major shifts in the vet landscape. What first made you realize something was changing?
Yeah, there's a big shift happening, and that's a problem. Is a lot of pet guardians don't realize a shift has happened, and they're going with what was going on before, like 10, 15 years ago. There was not one specific moment. There was not a big aha moment for that. It was an accumulation of small things. Like it started with the diagnostic creep. All of a sudden, routine appointments were not just routine anymore. We were doing an upsell of products and doing blood work and pesticides and dewormers. Like routine was no longer routine. A lot of the bills made no sense anymore. Like I'm looking at itemized bills and I'm looking like, what is a hospital care fee? What is medical waste disposal? So what all these fees that pet guardians will never understand. And most of all, there was a change of ownership of vet hospitals that lacked complete transparency. Like even for veterinarians within the industry, we didn't know if I'm referring to this emergency clinic. Is this owned by independent veterinarians or is it owned by a corporation? Because that will change also what we're trying to do. So those would be like, there was not a one moment, but it's just like a creep of small moments, one after the other.
Got it. So you've written and spoken about how corporate consolidation has reshaped the vet industry. From your vantage point, what does that change look like on the ground for vets and for pet owners?
I think the most insidious change that has happened in veterinary medicine that affects both veterinarians and pet owners, pet guardians, pet parents is the protocolization of medicine. Like it's no longer about the dog in front of me or in front of us. It's about protocols. I have protocols and I'm going to see how I can apply the protocols to the dog in front of me instead of the dog in front of me. What can we do? So in that, the most insidious change of the protocolization at the same time, which fits into that, is that vet practices have become a unit in a corporate portfolio. So the pressure to standardize everything intensified. So it intensified on the vets, and then the vets pass it on to the pets. So on the ground, it looks like vets like myself are losing autonomy, and we're pushed into more rigid trees of decision and treatment pathways that are not always adequate. Instead of me saying, hey, I think this is where we should go, I'm losing my autonomy. It's like, well, have you offered like these 5 tests, for example? And of course, for pet guardians, it means more tasks, more visits, more upselling, but that doesn't equate to better care necessarily. So to me, what we've lost in all of this, a big change is it's the dog in front of us. And I'm going with the dog because there's no other species that veterinary medicine deals with that has so much variation. From a Chihuahua to a Mastiff or a Great Dane, a Border Collie, they're all so different. So if there's one species, cats not too bad. Like cats will age all about at the same time and do the same thing. But I mean, in the dog world, we can have dogs, we can expect Chihuahuas to live 15, 20 years, but I don't expect a Bernese Mountain Dog or Great Dane to make it much more past 12 years. So if there's one place where standardized care is not applicable, it's right there.
Got it. So you often mention the importance of pet owners becoming high agency. What does that mean in practice, and why is it so critical right now?
Well, to me being, and I mean, veterinarian should be high agency, but because there's a structure in place, it's refusing to be a passive consumer of vet services. Just simple as that. It's to refuse to be a passive consumer of vet services.
Mhm.
So you are, as a pet guardian, you are the primary animal advocate. It's no longer the veterinarian, you are. And then there's two secret weapons that every pet guardians have in their on their side. It's always to ask why, and number two is what if we don't? Like those two questions should always be there as being part of high agency. So if we propose pesticides for 12 months for your dog, it's like why? And what if we don't? So we have to be able to empower ourselves to be able to ask a question. Why is it critical right now? Or there's a famous saying that says, hey, show me the incentive and I'll show you the outcome. Well, the consolidation of vet services does not automatically align with your pet's best interest. So being high agency is the counterweight to protocolized medicine. It's actually self-defense.
That's a really good advice for us. Yeah.
Why? And
Yeah,
what if we don't?
I
You need
always
to know
remember
that.
that.
Yeah, I'm trying to make it simple.
So many people assume rising costs are just about inflation, but your insights go deeper. What do you see as the real structural drivers behind why vet care has become so expensive?
Well, I mean, of course, inflation is part of the story. That's undeniable, but it's nowhere near the whole story. So we have to understand that in the consolidation of vet services and vet clinics, private equity has a debt service model, and that means that they have to service an acquisition debt and return to investors and a layer of managers. That goes way beyond inflation. Now, there are three new components that have entered in getting money to those three layers. So, and also what you have to understand is that in corporate veterinary medicine, practices are often measured in revenue per client, revenue per visit, or revenue per pet. Well, there's enormous pressure to maximize billing at each interaction. You become a transaction, it's not about care. The problem as well in all of this, it's not just inflation. I mean, there is certainly a de-skilling of veterinarians because it's like, hey, we got to run all these tests, questions asked, we'll do blood work, x-rays, blah, blah. So we're de-skilling the vets instead of the vets saying, hey, you know what, maybe we have financial constraint. I think the best thing to do today will be like a 6-panel, and that's where we'll start. But when vets are given protocols to follow all the time, they become de-skilled, and that's why your costs are going higher. And then finally, there's, which we saw in large animal medicine, there's a vertical integration. So vet clinics now are owned by the same company that owns the labs, that owns the pharmacies like Chewy's, that own the specialty hospitals, that owns the pet food. So it's no longer in your best interest because there is no competition. So to me, in all of that, if I can say it's not inflation, there's a lot of extraction going on that pet
Yeah.
guardians need to be aware of.
So, you've spoken publicly about ethical responsibility in animal care. What does ethical care means to you in today's environment?
Well, ethical care, if I take it, I mean, I'm a veterinarian, I'm a licensed veterinarian. I mean, ethical care from my point of view as a veterinarian, I mean, means that I have clinical autonomy, which implies clinical competence. It implies moral courage to not follow always and say, hey, you know what, I'm going to bend this a little bit and I'm going to go over here because what's legal and what's right is often not the same in veterinary medicine. And it takes moral courage to say, hey, this is the right thing, but it's not the legal thing to do. And it needs structure for us to be able to move into the ethical care. The ethical care to me means as well for the pet guardian is making sure that, again, it's the dog in front of us. gets the best care. That doesn't mean we need to poke this animal 10 times. That becomes animal abuse if we're like poking this dog 10 times, putting it through machines and testing and everything. So to me, ethical care means being high agency to say, hey, this will do for my dog. So, and it's not easy on both sides, but that's the only solution going forward. We all have to level up now.
So you advocate for both animals and the people who care for them, including vets and support staff. How have these changes affected morale and mental health in the profession?
Oh, it's been it's been quite a change. So when you start mingling vets that have worked, vets and techs, like all the staff, when you start mingling staff that have worked in independent clinics that are independent thinker, that are not protocolized, and now you bring them in an environment that they are very protocolized, or vice versa. I mean, it's a no-brainer. It's not going to work. It doesn't work well at all. So it's not, it's been difficult. And for the first time in my career, I know no one of my cohort that just said, you know what, I'm leaving veterinary medicine after 5 years or 10 years. This career is not for me. We all stuck with it because we loved it. We were passionate. I'm flabbergasted to find out how many younger veterinarians are leaving the profession. They're burned out, they've had enough. That never happened with our generation. So obviously the system is not serving well. I like, even if older vets like me are still thriving and happy and passionate, something is going wrong. It's not working well.
Mhm. So, are there moments in your work where you've seen transparency or education directly change an outcome for a pet or owner?
Oh, absolutely. I mean, at all level, we need to have full transparency. It certainly will help them. I mean, for some pet owners or pet guardians, they want to go to an emergency clinic that is not corporate owned, but privately owned for a different reason. Well, they need to know which is which. I mean, pretty much all the specialty clinics have been captured by corporation. So there's not a big choice there, but also like the transparency of what can we do when empowered pet guardians do ask the two magic questions:
Mhm.
why and what if we don't? That leads to a lot of transparency, and that means we're no longer in a transaction relationship. We are more in a relational relationship that we're trying to do the best for the animal, for sure.
Mm. Yeah, I think it feels more safe for me. Like if I can ask these two questions, I will understand more why we're doing this.
Absolutely. And also, you have to know, for some reason, you have to know that you can pause as
Hmm.
well. Like, people just think, oh my God, I've got to go. I mean, in some cases, we have emergencies and we have no choice. And I'll be firm. It's like, hey, we're going on oxygen right now. We don't have time to think about it. And I'll come back and brief you as soon as we're done on this. Like, we need to move. But in general, when we're talking about routine care and all of that, I mean, as a pet guardian, you can pause and say, hey, I need to check this out a little bit more and I want to give back, I'll get back to you tomorrow. There is no reason you have to act on the second unless it's an emergency. So why? What if we don't? And can we pause for a moment? Yeah.
Yeah, I think that's a really good advice you can give for a lot of pet owners listening to this today.
Yes.
So, for the path forward, if you could redesign one aspect of the current vet system to better serve both pet owners and practitioners, what would it be?
Oh, that's easy. I would I would break the corporate stranglehold on practice ownership. And I would not do it outright that it's bad all around, but I would allow structures to be put in place to allow independent and cooperative ownership models to compete fairly
Mm.
with corporate ownership right now. There is no structure in place for, so if you look at the corporate buying power, so if a company owns 100 vet hospitals, when they go buy a drug, one drug, they'll get a huge rebate on it. If I'm a small clinic and I just need like the one drug, I'm not getting a rebate. That clinic is already making a huge saving, whereas I'm not making that huge saving. So to break the corporate stranglehold on practice ownership would be number one. And I'm not banning it. Like, again, I want to say I'm not banning it outright, but it's to allow other structures, to allow other models to compete fairly with it.
Mhm.
Totally. Yeah.
Yeah. So, what role do you think transparency, whether it's pricing, ownership, or expectation, can play in restoring trust?
It's mandatory. Mandatory. There's no way forward if we're not trans. So imagine if I go to a vet hospital and there's no transparency about ownership or the billing. How do I trust you with my dog in front of you? Like it's absolutely mandatory going
Yeah.
forward. And I
That,
don't know how we escaped that for so long. Blows me
yeah.
away.
Yeah, I think this should be mandatory. And I remember there was one time I when like I need to get a quote for my dog's spay surgery, and then I call and then they said that they cannot tell me that. I have to go to the vets in order to know that. And actually, that would I would have no trust on that either.
No, and I mean, and the system of quoting can be difficult. And the
Mhm.
problem with it is when a pet guardian, through no fault of their own, are seeing different vets, the vet, myself, then cannot develop a close relationship and know where this is all going. And I know this pet, and if I'm going to surgery, it's likely this or likely that. Like I just see a pet for the first time.
Mhm.
But that doesn't prevent me from still giving good estimates. I can give you low and high. If the
Yeah.
surgery is fast, it's going to be this much. And if the surgery is complicated that I can't anticipate, like a lump removal, is it a little easy one that'll take me 10 minutes to get out, or is it going to take me 20 minutes or 30 minutes to get it out? So the low estimate is there, the high estimate is there, not knowing ahead of time what we're getting into. So transparency all around. Absolutely.
Yeah. Yeah.
Billing, ownership, absolute affordability of care. Totally.
Yeah. So, for everyday pet owners listening, what is one small thing they can do to become more proactive or empowered in their pet's care?
Well, they need to learn. I mean, although we've just talked about our two magic questions, but at the same time, we need to learn more about pets. I mean, to me, if I'm going to go buy a car, I mean, I don't like. Let's say I'm 15 years old and I go buy a car. I don't get behind the wheel and start driving it. I need to go to a driving school and learn how to drive this car. Like I've never driven a car before. So now we have pet owners that just go and walk by and say, oh, look at that. There is a dog for sale there in the pet shop. And I'll just buy it. It's like a 15-year-old that says, hey, I'll just buy a car and start driving it. So definitely we need to empower ourselves. And there's so many good sources of information. And I applaud when pet guardians come in. I always ask them, have you Googled this? And half of them will say, no, that's why I'm coming to see you and I trust you. And the other half will say, well, of course I did. And I said, well, great. So tell me what you found and let's work with that. And then I'll add or not to that. So to me, pet guardians, we need to learn some basic stuff as well. Like we cannot just like, how are we going to get where do you get your advice on nutrition? Where do you get your advice? When are you going to spay neuter your dog? Who do you listen to for that? Like, so you need to have that in place as well.
Mhm. So you've built such a strong voice advocating for fairness, access, and transparency in vet care. Looking ahead, what gives you hope for the future of the vet medicine?
Well, I mean, it sounds paradoxical, but what gives me hope is the systems are breaking down. Like it's not working. The vets are not happy. The pet guardians are not happy. The systems are breaking down. We can't band-aid this. I mean, there's problem from the vet school. There's problems everywhere. We can't band-aid this. So what gives me hope is we have a chance to rebuild something much better. But the pet guardians have to be active. They can't be passive. So being high agency is not being a passive consumer of vet services anymore. So I have hope that we can rebuild something much better.
That's very insightful. So, Dr. Judith, thank you so much for sharing your insights and perspective. This has been the Transparency Room presented by FareVet, helping pet owners everywhere find clarity, compassion, and fair cats. I'm your host, Emily. See you next time.
Thank you.